My name is Maria, and I give my daughter Marissa permission to record me. Come in.
Hi, Miss Marani. My name's Marissa. I'm going to be your student nurse today. How are you?
Fine. How are you, Marissa?
I'm good. Before we get started, I understand that we're going to do a full head-to-toe assessment today.
I believe that is correct.
Okay. And can you state your full name for me?
Maria Marani.
And your date of birth?
12/2/62.
And where are we right now?
At home.
Yes. Okay. So I'm going to start with your vital signs. We can start with temperature. Can you open your mouth for me? And close. There you go. 97.8. That's good. No fever. Let me get my timer. All right. Can I see the palms of your hands? I'm going to count your pulses, okay? Good. All right. So I had 16 breaths per minute, and 27 times 2 is 52 pulse. All right, so that's good. And now we're going to do your blood pressure. You may feel some tightness. Let me know at any point if it gets uncomfortable. I'm going to put this pillow here to elevate your arm. Good. It's bounding. Is that too tight?
Okay.
No. Okay. First, I just want to estimate your systolic. All right. You're going to feel pressure, okay?
Sorry.
It's okay. So I felt it obliterate at 130. That means I'm going to pump it all the way up to 160. right, same thing. You're going to feel some pressure. Let me know if it feels uncomfortable. (150/90). Full height. Do you have a history of high blood pressure?
Lately, it's starting to. It runs in the family.
Okay. All right. So now we're going to get started with our head, eyes, and ears, nose, and throat assessment. I'm going to go ahead and palpate your head. Is that okay?
Mm-hmm.
Can you take off your glasses for me before we begin? Thank you. All right. And just let me know if you feel any pain or tenderness. None?
Mm-mm.
Good. All right. Yes, I'm looking for hair color, hair distribution, any
Lots of hair.
lesions or anything like that. It looks good, nothing out of the ordinary. I'm going to examine your ears. Can you tuck your hair behind your ears? And I'm just going to go ahead and look back there. Good. All right. So no lesions or anything back there. The color is normal for your ethnicity. And I'm going to take a look up your nose. So I'm going to use this bright light. Can you look up for me? Good. Your nasal septum is midline and there's no perforations, which is good. And I'm going to shine the light in your eye.
Excuse me.
Okay. So when I shine the light in your eye, just go ahead, look straight forward at me. I'm going to shine it into your right eye first. Keep your eye straight. Thank you. Good.
I'm gonna tickle in my throat. Sorry.
Which is okay. Your pupils are equal, round, reactive, delight, and accommodation, which is good. I'm going to press under your eyelids. Can you look up for me? Good. Right. And can you smile? Good. All right. I'm going to shine the light again, and I just want to take a look in your mouth. Can you open up? And say ah. Good. So your buccal mucosa looks moist and pink, which is good. That's what we want. And your uvula rises with phonation. Yeah. So for cranial nerves, can you raise your arms up and down and up and back down? Good. All right. Shrug your shoulders as I push down. Can you pull my fingers for me? Good. And each finger, push it towards your thumb or touch your thumb. Good. Good. So on your knees, start slow, slap, and then on the dorsal surface, go and pick up the pace. Good. You can stop and clap. Looks good, nothing out of the ordinary. I'm going to examine the posterior surface of your thorax, so can you just turn so I can see your back? Thank you.
Do you want me to stand up or?
No, you can sit down, that's fine. So I'm just going to examine for any lesions or scars, anything out of the ordinary, birthmarks. Looks good. Skin is dry, warm to touch, and intact. Do you experience any back pain normally?
No.
No? That's good. And let me palpate. While I'm palpating, do you feel any pain?
No.
Okay. Okay. And I'm going to check for fremitus. So this is the vibration I feel against my hands.
Mm-hmm.
Every time you feel my hands touch you, say 99. Are you ready?
Mm-hmm. 99, 99, 99, 99, 99, 99.
Good. So it's good. Usually as we go down the back, the vibration will get, we'll feel it less. It diminishes. So for your lung sounds, I'm going to put the stethoscope under your shirt. Is that okay?
Yes.
Okay. And every time I touch your back, you're just going to take a deep breath in and out and let me know if you feel dizzy or out of breath, okay?
Okay.
Go ahead. Good. Lungs sound good. No abnormal breath sounds. All right, so I want to look at your arms for me. And I'm just going to palpate right here like I did earlier. So I'm making sure that I can feel the pulses at the same time bilaterally, and they're going at the same rate, which I can. They're bounding, which is good. Oh, I'm sorry. Can you turn towards your right side? I need your right side. So turn so I can see your right side. Is that your right side? Yeah. I have to listen here because the right side or the right lung is mainly facing on the right side, whereas I can't really hear it on the back. So same thing. Can you take a deep breath in and out when you feel it touch you?
Mm-hmm.
Good. All right, again, so it sounds good. And then you can turn around and face me. Thank you. So I'm going to palpate for pain like I did on your back, but now on your anterior thorax. Let me know if you feel any pain or tenderness. Okay, good. And again, I'm going to listen to your lung sounds on the front. Actually, I'll start with fremitus again, because that's what we did before. Again, when you feel me touch you, you're going to say 99.
99, 99, 99, 99.
Okay, and now I'm going to listen to your breath sounds. Deep breath in and out when you feel the stethoscope touch your skin. Everything sounds good. All right. So now I want you to lie back down on your back, your head facing here, okay? And I'm gonna put this pillow here. So I'll put another pillow. Can you lift your head for me? Thank you. You can lie back down. So this is supposed to mark a 45-degree angle, as we would have in a hospital bed, but we don't here. So I'm gonna look for jugular vein distension. Can you turn your head to the left, and I'll look on your right side. Good. So it's not distended, which is good. That's what we want. Can you turn to the other side? Good, not distended. It's perfect. That's what we want. So again, I'm going to auscultate, but I'm listening for your heart sounds. And I'm going to listen in all 5 areas. You can breathe normally. So S1 and S2 were both heard, which is good. No abnormal heart sounds, murmurs, or anything like that. Hello. Alright. Now I'm going to listen at your carotid arteries, and I'm going to use the bell.
Need my office at.
I'm doing a video, sir. Alright, so I'm going to use the bell of my stethoscope to listen to your carotid artery. Good, can you turn your head to the other side? Good. So we do that to listen for any bruits or bruits. Bruits are turbulent blood flow, and we don't want to hear them. So I didn't hear them, which is good. Do you experience any normal stomach cramps usually?
Only when I eat bad foods.
Okay, that's okay. I'm going to examine your abdomen. Is that okay?
Yeah.
Okay. I'm looking for symmetry. And if it's round and not distended. So it looks symmetrical. Good. It's not distended and it's round. So that's normal. And I'm going to auscultate again. I'm going to listen to your bowel sounds. So I'm going to listen in all 4 quadrants. I'm going to start in your right lower quadrant and move clockwise, alright? And you can breathe normal again. Just using the head of your stethoscope. It was actually louder in your left upper. And I'm gonna percuss down to here, starting up here.
Mind him.
So we heard a tympanic sound when I was percussing, which is normal. That's good. And again, let me palpate for pain. Let me know. Starting in pain. Alright, good. Alright, can you sit up again for me? And we're almost done. So I did this earlier, but let me go ahead and do it again. Let me see your hands. And I'm going to palpate. Make sure they are still bilaterally or pounding bilaterally at the same rate. Good, yep. They are, and flip over. I'm looking at your capillary refill, so I'm just going to push down at each fingernail bed. And capillary refill is less than 3 seconds in all 10 digits, which is normal. That's good. That's what we want. You have good peripheral blood flow. And I'll just use your right hand. I'm looking for skin turgor. Good. Your skin is elastic, which is normal. You're not dehydrated or not showing any signs of dehydration. Can you lay back down again for me?
Mm-hmm.
So we're starting with your lower extremities. With your left leg, can you bend it in and go back? Actually, sorry, raise up, bend in, and go back. You don't have to raise it that high. Raise up, other leg, yes. No. Yeah, and back down, good. Okay. And you don't have any bruises or anything like that. Hair distribution is normal on your legs. A little hairier on that. No scratches. So, I'm palpating for your pedal pulse, which is on top of your foot. And they're bounding bilaterally. Can you push against my hands? Good. Push against my hands. Good. All right. There's no swelling or signs of edema around your ankles. And I'm going to test the sensory sensation on your legs. So close your eyes for me. Close your eyes, and you're going to say the word now whenever you feel me touch on your leg, okay? Close your eyes. Ready?
Now. Now.
Cute.
Now.
Good. Keep your eyes closed. I'm going to touch on your lower extremities again. You're going to tell me what part I'm touching, okay?
My shin, right shin.
Mm-hmm.
My right instep.
Yes.
And left toe. Big toe.
Big toe, okay. So you can open your eyes, and we're going to do capillary refill on your toenails.
Can I take my socks off?
They're off. So, good. Yeah. So you have good capillary refill to all 10 digits, less than 3 seconds. We have good peripheral blood flow going down to your legs. And last thing we're going to do is, can you move to your left side so I can see your back?
Like this?
Yes. And I'm palpating here. Do you feel any pain?
No.
Tenderness?
No.
Okay, good. And I'm going to look. Is that okay?
Yeah.
And I'm looking for any lesions. Nothing. Looks good. Great, so I think that's it. Do you have any questions for me before I go?
No.
All right. Thank you, Miss Mary.